wanted to provide you with 3 general exercises that could have a positive impact on your clicking or locking jaw. The following 3 exercises work by improving the jaw alignment, improving the tongue muscle activation, and by reducing the localized jaw muscle tension. The details and correct form and pace of these exercises is important, and like any other form of exercise, consistency and load is also very, very important. For best outcomes, rehab/exercise prescription should be tailored for the individual patient after completing a thorough assessment, and specific hands-on techniques would be used to help optimize jaw and muscle function. But for now, let's just get back to our 3 DIY exercises. Our first exercise, straw rolls. So sitting or standing with your feet grounded, tip of the tongue resting on the roof of the mouth. Place a straw or similar object in between the front teeth and slowly roll the straw side to side, ensuring that the tongue stays resting on the palate. Our second exercise is tongue circles. So sit or stand tall with your feet grounded. Once again, tip of the tongue on the roof of the mouth, which is just behind the front row of teeth. So you're going to draw a circle with your tongue inside the cheek. Do your best to keep your lips sealed and try to really reach those top corners of the mouth. That might be quite tricky. Go 3 in one direction and then go 3 in the other direction. Our third exercise is guided partial range jaw movement with resistance. What you're going to do is you're going to sit, you're going to stand nice and tall, grounded feet, resting the tip of the tongue on the roof of the mouth. Once again, we're going to use a finger to rest just underneath our chin. Okay. From here, you're going to slowly open your mouth to a comfortable range, as small as that needs to be for you to keep your pain level 0 out of 10, so no pain whatsoever. At this range, you're going to be trying to open your mouth. So at that comfortable range, you're trying to open your mouth. You've got resistance here of your finger as you do so. And I'm going to be holding this position here for 5 seconds, and then I'm going to slowly close my mouth. I'm going to repeat this exercise a handful of times, seeing if I can get just a little bit more range each time. Some important things to note is that we're not shifting our head forwards to make this movement happen. And I can't reiterate this enough, but please make sure this is comfortable, so 0 out of 10 pain, please. For the treatment of a popping, clicking, or locking jaw, please repeat these exercises 1 to 3 times per day for a few days and see if you notice a change. Please do not be disheartened if these didn't work for you. Instead, I encourage you to be curious and present your experience trialing these exercises to a trained healthcare professional, as this feedback is helpful clinical information for us. If you'd like to get in contact and like to make an appointment,